Welcome to Tupelo. We hope you enjoyed the North Mississippi area while you're here. As a 5-time winner of the All-American City Award, Tupelo has a lot to offer. Whether you're looking for a night on the town or family-friendly activities, Tupelo will have something for you. One of the most important things to consider when moving to a new place is the culture, and more specifically in medicine, what about that culture directly impacts your patients? We serve patients throughout a very rural service area, and rural in healthcare often means that our patients have limitations to both access and education regarding health and well-being. As a result, one of the main disease processes we see is hypertension, which, as you know, leads to various other medical conditions over the course of time.
Huge problem, especially around in this half of the country. I think it can be difficult and somewhat challenging sometimes to portray that to your patients. And so kind of that dialect between the physicians to the patients, because a lot of times, somebody will walk in with extremely elevated blood pressure just to a clinic and they feel completely fine. So they don't really understand why we're attacking this and what we're doing. So.
With our patient population and with society in general, it can be very difficult to control these things, especially if you've grown up in a culture where these things are seen as the norm.
We've asked some of your fellow residents what are the top 3 causes they see in this population for hypertension. Here's what they said.
The top 3 causes for a lot of the health problems I see are mainly diet, especially with the food down here and the culture down here. That contributes to a lot of things in terms of higher cholesterol and fat and sodium in a diet.
Sedentary lifestyle.
Smoking definitely really contributes around here. It's still very prevalent.
Diet, a lot of fast food.
Smoking. I think smoking is super prevalent here.
A large part of it is lifestyle, and unfortunately here in the South, the food is really good. Like a colleague of mine told me that we put butter on everything like it's an Olympic sport. There's salt in everything. I think people just don't realize the amount of salt that they're taking in, or the consequences of having such a great tasty diet. And
we have also asked how they coach to a better lifestyle for this area.
My visit, I focus on patient education. So I will talk to the patient about his diet, keep the low salt diet, is he taking his blood pressure medicine regularly, how is he compliant with the blood pressure medicine. And in addition to that, right now in our clinic, we are encouraging our patient to check the blood pressure at home and keep a blood pressure log and bring it the next visit, so we can make decision as regard medication based on multiple blood pressure reading instead of making a decision on just one single office reading.
That I always make a point to do is to do the ACSVD risk calculator and let them actually see that number and see what their percentage chance of getting a stroke or a heart attack or heart disease is in the next 10 years. And that's a real eye-opener for a lot of people. And so when you have that understanding with patients, I think it's a lot easier then to say, what are we going to do about these things? And
health literacy has kind of always been an issue. People don't understand what causes hypertension, or I feel like a lot of times as providers, we know like you need to eat right, you need to try to exercise, and we say all that, eat right, exercise, but what does that look like for somebody? Why, what is their barrier to eating right? Do they know?
The second challenge is that might be unique to the region is you're going to have to deal with, are they going to pick it up? Are they going to take it every day? Do they understand when to take it, how to take it? Can they afford it? And all those things that are not necessarily taught in med school will come into play, in fact, when you take care of certain patients in our area. If you feel like the patient will not be compliant due to economic, social reasons, you have to have a backup plan, as in, can you get him samples? Are you going to bring him in more often to have a closer monitoring? Those are the stuff that you kind of learn as you go from your uppers, your attendings definitely, to...
It's easy if you focus on one thing in their diet and try to change that first, and they'll be like, okay, that's not too bad. Because I feel like once people hear that, oh, you have high blood pressure, do this, this, and this, it's very overwhelming. And it's hard for people to remember like all those things you say in one visit. So that's one good thing about having like clinics and continuity of care. You can work on things little by little and be like, okay, let's work on this. And then next time, like, and then congratulate them when they do something good. Like if somebody loses 5 pounds, that's a huge deal. I mean, they still might be overweight, but at least we're working towards the goal. So I think really just taking time, breaking things down into smaller bits that's more easily digestible.
In short, we do have a long way to go on the heart-related diseases in our service area, and we are trying to improve that every single day. At North Mississippi Health Services, our goal is to provide the best patient and family-centered care in the U.S. We hope you enjoy your time with us as you grow as providers and help us lead this population's health better than we found it. What would be a piece of advice you give to new residents coming in?
I think for me, 3 years sounds like a long time, but intern year has absolutely flown by. So I would just recommend that they absorb as much as they can, enjoy it. And a piece of advice I got from one of the attendings here was to take an actual interest in the lives of your patients, and that can connect you better to the patients, and it can help you troubleshoot things that can influence the rest of their lives. Hypertension is a big problem here, and just taking the time to understand patients' day-to-day lives, what they struggle with, their diet, what they eat, and giving them counsel on that. You may not affect everybody, but you certainly can make a bigger difference on someone's life if you just take a keen interest in their lives rather than just seeing them as different medical problems.
Good luck on your first year of residency.